Okay, hello, our lovely patients out there. Now, I'm Dr. Fern at Beacon Cove Dental. I'm actually in self-isolation at the moment, coming back from teaching a retreat in Hawaii. But I wanted to video with our incredible team to let you know that we have been putting absolutely every single measure in place to make sure that we can offer you the most safe, the healthiest, the most controlled environment, because we want you to feel safe and secure, but also pain-free and have great health, particularly during this time when there is so much uncertainty and anything could happen. So I wanted to touch base with you right now and let you know that even though we have been practicing the utmost, and we don't want to really call this, but infection control measures as a clinic, and we have had incredibly high standards, because it's not just particularly this CV virus that's an issue, it's all the other viruses that are around us all the time that we are always making sure we are all protected from, and you are protected from, and our team are protected from. But we wanted to reassure you on what's going on, that we are currently open, more so for emergencies at the moment, and we have really scaled back to keep our team protected, but also you as protected as possible, while making sure that none of you run into dire straits or have any big problems, particularly during this time. So I wanted to first of all reassure you and let you know at this time being, we are open, and if there is an imminent full shutdown or lockdown, we will be doing virtual consults so that we can still keep in touch with you, you can still keep in touch with us, and we can help you as much as possible if there are any real emergencies that really flare up. So we just want to let you know that you are supported, you are cared for during this time, while we are really adapting as much as we can to make sure that we are keeping up to date as much as we can with the highest levels of control. So Dr. Alice and Liz, our patient manager, is with us today. And I just wanted to ask, Alice, what extra measures are we taking in our practice? I mean, actually, in fact, Liz, if I pull it back, Liz, what are you taking right from the start, from the front line, to make sure that our patients are safe, that our team are safe, so that we can look after our patients? What are you doing?
So 48 hours before your appointment, we are going to ask you some questions and screen you essentially, just to make sure that you're not showing any of the symptoms, and that you haven't arrived from overseas 14 days ago, and that if you are displaying any of those symptoms or you're in self-isolation like Fern right now, we're rescheduling your appointment 2 weeks later, and waiving the cancellation fee as well. So we're being really precautious with patients. If they are, feeling they've got a cough or, a higher temperature, we've rescheduled all those patients just to be safe rather than sorry. So that's the first thing that we're doing. When you come into the clinic, we're asking you to use the hand sanitizer of the reception desk, or going into the bathroom and just washing your hands. We've also rearranged the chairs in the reception area as well. Respect social distancing that I'm sure we're all trying to do right now. So everyone's sort of keeping their distance. We've got a line at reception desk as well, just to show what that distance is like as well. At the same time, normally we don't see that many patients in our clinic anyway, just because we spend a lot of time with our patients. So risk of contact with other patients in the clinic, we're trying to minimize that as much as possible. In terms of other things, sorry, Fern.
I was just saying, and we are washing our hands so much more than ever, yeah. Disinfecting all our surfaces as well. I know you're going into a mad frenzy, disinfecting.
Yeah, wiping down everything that a patient touches, so the door handles, the pen, clipboard, EFOS machine, the front desk table. If you go to the bathroom, we're wiping down all the door handles, anything you might touch, taps, etc. as well. And lastly, in terms of payments, we're preferring contactless ones, so you just need to tap it and put in the PIN number rather than us having to handle it more than usual, as well as cash, And
everything's getting wiped down in between.
Yes, definitely.
All those extra protocols. Now, Dr. Alice, in the clinical rooms, right, we're really constricting everything to emergency appointments, which really appointments where we want to make sure that the patients don't also run into an emergency during a possibly lockdown phase, of everything. So Alice, what are we doing on top of already very stringent measures that we already had before to even help patients more right now, and ourselves?
We're we're introducing hydrogen peroxide mouthwashes to patients to hold it in their mouth for half a minute before we start any procedures. Obviously, with the type of work that we do, if the procedure itself involves a lot of aerosol, which is this water spray and air droplet particles that gets created, we would like to minimize the amount of aerosol created. Or again, if your dental conditions wouldn't impact your health directly, or if we left it for about a few months, if it doesn't come to a point where it's irreversibly harmful to your health, then anything elective, we would like to defer it as much as possible. With the aerosol perspective,
the hydrogen peroxide was there because it's been shown to kill 95% of the viruses also. Yeah, okay.
That's correct. And we already work on the rubber dam, the rubber cover, to protect your airways, protect your the tongue and the teeth. We only isolate the teeth that we are working on. We are also using disposable biodegradable products as much as possible to minimize any cross-contamination. Personal protection gears, we are already so equipped in the dental industry. We have universal protective infection control measures that's already so well trained and well organized, but we're actually doing a lot more to minimize any cross-contamination.
Beautiful.
Especially with dental conditions, say if you had an abscess, toothaches, or gum infection or tooth infection, it can lead to systemic effects and systemic illnesses. And it's a real true story to have dental issues causing hospitalization, or you might end up needing a hospital care, but there's a lot of, panic around whether that's going to be possible given the healthcare system so inundated right now. And so we're doing everything that we can to reduce the burden on the healthcare system, but at the same time using our common sense to defer any elective treatments.
So if our patients actually have been told that things could be a potential problem, please come and be seen while we are open right now, because we don't know how long we're going to be open for. And the last thing that we want our patients to have is pain or emergencies during a time where we can't fully serve in the capacity that we want to serve. What we are doing in the meantime, we're hoping, is we're also running virtual consults for people who are in dire straits, so we can be there constantly for you throughout this time. And we're always seeing what more we can do on top. But these, really depending on what the government constricts on us, or the constraints that are put on us, we may be able to see for emergency treatment, or it might just be virtual consulting, so we can give you, pain relief or things like that virtually. And the other things we're also doing is, in this time when everyone's in lockdown, we're also offering consults virtually for any other things that you want to talk about in dentistry, be it your smile design or cosmetic work or ortho consults or anything like that. Or even Bronwyn, our hygiene and myofunctional therapist, is going to do some virtual consulting online with myofunctional therapy for kids, which is teaching kids how to chew, breathe, all of those things properly, so that they may not need orthodontic treatment later on. So that's a big thing. So be prepared for that as well. Guys, is there anything else you want our patients to know? I mean, the main thing for me is, please, during this time, the best thing that you can do for yourself is be stress-free, because that is going to boost your immunity a lot by being stress-free and calm. Stress is actually going to really put us in a state of frenzy, of panic, of scarcity, of killing our bodies, literally. And we need everything that we can right now to boost our immune system, not just avoid the virus, but also boost ourselves and our ability, because we have this exquisite pharmacy here that knows how to fight if we give it things that it needs. So good sleep, lots of rest, vitamin C, selenium, zinc, vitamin D. What else do I take? Olive leaf, and a whole bunch of other stuff to help boost our immune system as well. So take care of yourself and take care of each other. Ladies, was there anything else that you wanted to add to our patients?
As such, right now, dental clinics, an emergency service, an essential service. So we are open as usual, Monday to Friday and some Saturdays. So at this point in time, feel free to give us a call, get as much emergency treatments or things that are going to fall apart, get those done as quick as possible, so then you are not in dire straits, basically.
Yeah. And even our hygiene appointments for people or patients of us who have high risk, like if you've got any other medical conditions, we also advise you to come in and get your maintenance or your periodontal hygiene appointments done. Don't delay that, because that's going to be a huge booster to your immune system. So they're the things that are the necessary at the moment to help you be as safe and healthy as possible during this time. Okay. So ladies, thank you so much. We are all here to serve. These ladies are on the front end looking after you so that you can be safe and healthy and pain-free during this time, so that you don't have to worry about your teeth, hopefully. And ladies, anything else you wanted to add to our patients? Just look after yourself. Yeah. Yourself, and you will hear from us. You will hear from updates on how things are, but we are here for you, and we will be here for you constantly throughout this whole situation, is what I'm going to call it right now. It will blow over and we will be here. Okay. So please give us a call if you're unsure about anything. If you want to have a look at your treatment plan, see what things might need doing before we may be shut, please do not hesitate to call us straight away. We will try and see if anyone high risk, and we'll try and contact them, but we are inundated at the moment and there is only so much time. So please do yourself a favor and be proactive about it. But just know that when you do come in, you will be safe, you will be protected. We have put in everything that we can to make sure that that happens. Okay, so looking forward to you all being healthy, safe, and we all overcoming this in the best possible way. Big love to you all.